As clinical healthcare professionals, we often develop special bonds with patients and their families. When these patients face difficult diagnoses or unexpected pass away, it can be challenging for nurses who have formed personal connections with them. In such situations, it's essential to offer the family support and condolences while allowing them privacy to grieve. Nurses should avoid becoming overly emotional in the presence of family members and instead focus on providing care and support. When a patient is facing a difficult medical diagnosis or is at the end of their life, nurses should give the patient and their family time to be together. Then offer condolences and support. It's also crucial to provide information on community resources if needed. Nurses have an ethical responsibility to support the family during this challenging time, rather than making the situation harder for them. If a nurse becomes emotional, they should take a moment to compose themselves in a private area before returning to the patient and their family. In situations where a nurse witnesses a colleague engaging in unethical behavior, such as stealing medication, it's essential to report the incident to a supervisor. Nurses have an ethical responsibility to uphold the standards of their profession, and reporting such behavior is crucial in maintaining a safe and trustworthy healthcare environment. When reporting the incident, nurses should provide detailed information about what they witnessed and allow their supervisor to investigate and take necessary actions. Nurses, like all healthcare professionals, can make mistakes. It's how they handle these mistakes that matters. When a nurse makes an error, they should take responsibility for it, apologize, and work to mitigate the situation. In the case of administering the wrong medication to a patient, the nurse should immediately notify their supervisor and work to develop new procedures to prevent similar mistakes in the future. By taking ownership of their mistakes and working to prevent them, nurses can demonstrate their commitment to providing high-quality patient care. Joining a new team of nurses can be intimidating, especially when the team has already established working relationships and a specific way of doing things. To become a valued member of the team, nurses should be patient, friendly, and curious. They should strive to develop relationships with their colleagues and work to understand the team's dynamics. By being open-minded and willing to learn, nurses can overcome initial challenges and become a functional member of the team. Workplace violence is a common issue in healthcare, and nurses often find themselves in stressful and dangerous situations. When patients or family members become violent, nurses should stay calm and follow established protocols, such as alerting colleagues and security. It's essential to avoid retaliating against the aggressor and instead focus on de-escalating the situation. By following protocol and working with their team, nurses can minimize the risk of harm and provide a safe environment for patients and staff. In situations where patients become violent due to dementia or confusion, nurses should attempt to de-escalate the situation and use restraints if necessary, always prioritizing the safety of the patient and others.